Hello everyone, I'm Dr. Ala Musbah, Professor of Obstetrics and Gynecology, Faculty of Medicine, Mansoura University. Today, I want to discuss with you the list of content of my newly published textbook of Obstetrics, which published recently on Amazon. Okay, so what about the list of content? But before I start, I would like to thank very much my family who supported me in every second in my life. Also, many thanks to my patient, my students, my friends, and my colleagues, and my professor in different parts of the world, and specifically in Mansoura University in the Faculty of Medicine. Thank you very much to everybody supporting me at any time in my life, and specifically my patients who teach me every day everything. Okay, so textbook of obstetrics is divided into 10 sections, each section formed of some chapters related to each other, and each section end by updated references, as we'll see. Okay, let us start our journey with the cover of the textbook of obstetrics. Looks like that on Amazon. Okay, so what about the list of contents? Let us start with the first section, which including chapters related to each other, as I said, starting with fertilization, implantation, and the normal development of the placenta and the embryo. Okay, going through the anatomy of the placenta and the umbilical cord and any abnormalities related to placenta and umbilical cord. Then, what about the placental function? What about the fetal circulation? Then we are going to discuss the physiology and metabolic changes during pregnancy. Then how to diagnose pregnancy and what the investigation can be done in obstetrics. Then the antenatal care, and lastly the references. And the page of reference in this section at 37. Let us go to the second section, which is covering many chapters, as you see, starting with the female bony pelvis and the fetal skull, some obstetric terms like lie, presentation, position, engagement, syncretism, and asyncretism. Okay. Then normal labor, the physiology of normal labor, stages of normal labor, and everything belongs to normal labor. Then the management of normal labor, then some malpresentation like malposition like occipital posterior, and the malpresentation like breech presentation, transverse lie, face presentation, brow presentation, compound presentation, cord presentation, and prolapse, and lastly references at page 112. Then the third section starts with complication of third stage like retained placenta and placenta accreta spectrum and postpartum hemorrhage and uterine inversion. Of course, we are talking here about the acute inversion, which develop immediately postpartum or during the early days of puerperio, and end by references at page 128. The fourth section starts with miscarriage, ectopic pregnancy, hereditary mold. As you see, this is the causes of bleeding in early pregnancy. Then chapters related to bleeding late in pregnancy like placenta previa, placental abruption, vasa previa, and this chapter related to bleeding in early and late pregnancy end by references at page 175. Let us go to the fifth section in textbook of obstetrics, which include very important medical diseases during pregnancy, starting with the hyperemesis gravidero, going through the diabetes mellitus with pregnancy, thyroid disease in pregnancy, anemia during pregnancy, different types of anemia like iron deficiency anemia, pernicious anemia, thalassemia, sickle cell anemia, and so on. Hypertension with pregnancy, preeclampsia and eclampsia, and chronic hypertension with pregnancy, heart disease with pregnancy, whatever, congenital or acquired, and so on. Venous thromboembolism during pregnancy, and urinary tract diseases with pregnancy, including urinary tract infection, including renal failure and the renal transplant with pregnancy, and AKI with pregnancy, acute kidney injury with pregnancy, and so on. And this chapter ended by reference at page 262. Let us go to the sixth section, which include contracted pelvis and cephalopelvic disproportion, the intrapartum care, and what about the WHO recommendation in 2018. Then going through the partogram and the updated partogram or changed recommended on partogram recommended by the WHO, what is called labor care guide, published in 2020. Then the abnormal labor. What is the abnormal labor? What is the definition? And how to diagnose and manage. Then the antenatal fetal well-being test. What are the methods for antenatal fetal well-being test? And what is the intrapartum fetal assessment, or how to do it? And ended by references at page 320. Then let us go to the seventh section with complicated labor, starting with shoulder dystocia, which is very important emergency, and also what is very important, which is the obstructed labor and uterine rupture, and also the genital tract and the perineal laceration. And this chapter ends with reference at page 337. Eighth section start with fetal growth restriction, post-term pregnancy, preterm labor, going through pre-labor rupture of membrane, multiple pregnancy, RH isoimmunization, polyhydramnios and oligohydramnios, neural tube defect, and intrauterine fetal death. And as you see, this section related to obstetric disorder, related to fetus and amniotic fluid, and ended by reference at page 400. Ninth section about the operative delivery, whatever vaginal operative delivery or cesarean section, vacuum delivery, forceps delivery, cesarean section, episiotomy and repair, and different types of episiotomy. And here in this chapter, I describe 7 types of episiotomy. You can see them, and you can know the indication of episiotomy, the advantage and disadvantage, and the detail of different types of episiotomy. In comparison, I put them in a table. And this section ended by reference at page 418. The last section in the textbook of obstetrics is the 10th section with very important subjects like normal and abnormal puerperium, maternal and perinatal mortality, perinatal asphyxia, COVID-19 and pregnancy, and the recommendation of Royal College and the guidelines published in October 2021. Okay, what else in this section? The high risk pregnancy and shock in obstetrics, especially the types of shock in obstetrics, and what is very important is the hypovolemic shock also. Also, chapter about imaging during pregnancy and lactation, including ultrasound, MRI, X-ray, CT scan, what is the problem with that, and so on, what is safe and what is not safe as regard the imaging, and chapter about the obstetric analgesia and anesthesia, what is updated in this field, and this section ended by reference at page 462. This is the 10th section related to textbook of obstetrics, which is published on Amazon, and you can go to the Amazon through its link. In two forms, it is available in Kindle form, ebook, and also in paperback form. You can ask any form of them through Amazon. This is the link of the Amazon, and this is the textbook of obstetrics. And lastly, thank you. I'm Dr. Ala Musbah, Professor of Obstetrics and Gynecology, Faculty of Medicine, Mansoura University.